Welcome, everyone. It's great to see you. I'm Dr. Charles Elder. I'm the Executive Director of the Fellowship MS in Integrative Medicine and Ayurveda at Maharishi International University. And I'm here with my colleagues, Dr. Leslie Elder and Dr. Sankari Wegman. So this is a chance for us to talk to you about the fellowship and for you to get your questions answered and get to know what we're about a little bit. And this is our first fellowship webinar of the season. So welcome, and you're in the inaugural group, so that's very auspicious. Our agenda is very straightforward. We're each going to each of the three faculty here. We will each tell you a little bit about the program to give you a sense for it, and then we'll open it up for questions. And we will introduce ourselves after we give you a chance to introduce yourselves. So what I'll do is just ask each of you to introduce yourself, your name, where you practice, what you do. Doesn't have to be long, just to let us know who's here. Any volunteers to go first?
I'll go first.
Go ahead.
Uh, Hi, my name is Bhavi Shah. I have a doctorate in nursing practice. I am a nurse practitioner, adult nurse practitioner with a doctorate. My focus is internal medicine, and cardiology has been my practice for now over 8 years, close to 8 years now. And I have recently purchased my own practice. I have started my own clinic, and I wanted, although I'm not into alternative medicine or integrative medicine, I do know that a lot of my patients have asked me about, if I could give them some insight into natural supplements and naturopathy, alternative medicine, and I have not been able to do that. My practice is completely allopathic. I can give them medications, I know my guidelines, and I can guide them that way. So that's been one of my one I have wanted to do this for a long time, or I've looked into a few things, and now having that, being that I'm going to start my own practice, hoping to open doors of my clinic in June, I want to be able to see if I can start this process and kind of go along the way, and hopefully incorporate alternative medicine, integrative medicine into my practice as well.
Very exciting. And I'm curious, what part of the country?
I'm in Oklahoma.
Oklahoma. That's cool. We have a number of our fellows in Oklahoma, Oklahoma City. Thank you very
Yes,
much.
yes. In
Um,
fact, I would like to add that my very close friend, Kanan Shah, she's the
Gotcha.
one that told me about
oh,
MIU.
yes.
We talked about it, and she sent me all the information. She just bombarded me with the information, and here I am.
She's one of our stars.
Oh, yes.
Okay. Um, if you don't mind, Tina, I'm looking right at you.
Yeah,
So you're next on
sure.
my screen. Go ahead.
My name is Tina Periani. I am an internist and I specialized in geriatrics. I've been doing like wellness primary care. I've been employed all these years and I left my practice last year, not my practice, wherever I was practicing last year, kind of because of burnout. I've been traveling. I went to India, did some panchakarma. Always had an interest in Ayurveda, also because I'm kind of a student of Vedanta. I've been studying or, yeah, on this path, the spiritual path, since I was 17. And this just seems like the natural next step for me.
Wonderful. And I love geography. Where are you
Houston,
at?
Texas. Houston, Texas.
Houston.
Yeah.
Okay. Thank you very much. That's very exciting. We have fellows in Hugh. We have one of our graduates was in Houston at MD Anderson.
Yeah,
Okay.
yeah, yeah. At Anderson, Santoshini.
There
Santoshi,
you
yeah.
go.
Santoshi.
There you go.
Yeah, Yeah. she's actually
Okay.
my doctor. I'm a patient at Anderson.
There you go.
Ah,
Okay. Amparo, if you don't mind.
Hi, I don't know if this is relevant. I'm a dentist
Oh, cool.
from New York, but I'm not practicing right now. I became a coach, and I'm a survivor of stage 4 cancer for the last 14 years. So I'm just wanted to learn, I don't know, to be able to help my patients, my clients.
Amazing. Amazing.
Mhm.
We
Welcome.
welcome, very welcome.
Thank
Uh,
you.
Roshan,
Yes, hi. My name is Roshan Shirali. I'm a nephrologist. I'm from Illinois. And I think I have two reasons to join this call. A, my friend is currently a fellow at the program. And we always chat about, how internal medicine and the modern medicine has sort of like drifted away from the basics of like holistic approach towards the patient. And there are a lot of patients who comes and ask me about the natural supplements which they want to take to see if they can delay the progression of chronic kidney disease. And I either Google it or now I ask ChatGPT or Open Evidence or Cloud or all the AI tools available. But I always refer them to a naturopath. And I was like, it won't be a bad idea just to attend the call and see what it entails and see if I can commit the time to it because I'm interested in pursuing the fellowship, but I think time would be a limiting factor for me. But I would love to hear more about the program.
wonderful. Thank you very much. And uh, DM, if you don't mind, we're just doing brief introductions.
Uh, hey guys, how you doing?
Hi.
Hi, I do it. Yeah, really trying to learn more info about the fellowship and trying to check it out. I am a TM practitioner or try to practice it on a regular basis. So yeah, kind of wanted to check it out.
Great. Are you practicing anywhere?
Uh,
Healthcare practitioner?
oh yeah, family practice here in St. Louis.
Okay.
Yeah,
Family practice in
yeah.
St. Louis. Wonderful. We have a number of our fellows in St. Louis,
Oh, awesome, awesome.
as you may know. Okay. Noreen, welcome. Welcome. Noreen, do you want to say hi?
Hold on. I hear you. I hear you. For some reason, my video does not want to start. But I will, hold on. Not sure why it's not going. But anyway, I'm going to introduce myself. I am Noreen Purcell Dillman, and I have been with MIU for 5 years, been studying Ayurveda for 15 years. And I am not a licensed medical professional. I work in the admissions department at MIU, so I am your first point of contact when you submit your application for the MS fellowship and work very closely with the team, particularly Dr. Elder. Myself, I'm on my second master's degree at MIU. Call it glutton for punishment. I finished the MS Ayurveda Integrative Medicine program, which is you do not have to be a licensed health care provider for that. And I am currently doing the MS Ayurveda aromatherapy program, so a little bit more than each. So happy to meet you all. And if I can answer any questions or be a conduit for you, just feel free to reach out.
Thank you, Noreen. And that's one of the things that Noreen's story exhibits is that the knowledge that you're going to gain in this fellowship is very profound. And a lot of people like Noreen and us, since when you teach something, you learn it, just want more and more. And that's really why we are all, or part of why we, the faculty, are here. So what we'll do now, if you don't mind, I don't think I skipped, did I miss anybody? Doctors Leslie Elder and Shankari Wegman, we'll ask them to introduce themselves when they speak, which will be in a few minutes. I hope that's okay. And I'll start. I'm Dr. Charles Elder. I'm an internist by training, and I was at Kaiser Permanente Northwest. for
Oh,
over
I
30.
actually want to, Dr. Elder, I was hoping I could say one more thing. I'm sorry. I don't mean to
You're
interrupt.
on.
Um,
Uh,
I came to natural health a different way, and I think most of you being medical professionals will relate to this. But many years ago, I left it in 2008, but I was an elder law attorney. So I specialized in working with elders and their families, all legal issues. And I didn't see any of my clients who were using strictly modern medicine, really, the healthcare system, there's so much stress on my clients and their families that I went on this journey starting in 2008, actually, looking for what is the meaning of health and wellness. So I wasn't a medical professional, but I worked for 14 years with elders, and just saw that, this was a situation that for myself and however I can contribute professionally, I wanted to be a part of. So,
Thank you.
sure.
And Noreen is a key player. So those of you who choose to apply for the fellowship, she'll be a key player in guiding you through the application process, which is quite straightforward. Okay, so I'm a general internist by training, and I worked at Charles Elder. I worked at Kaiser Permanente Northwest for over 30 years, full-time primary care, and over the years integrated the Ayurveda and integrated medicine into my practice, um, and had both primary care practice and a referral-based integrative medicine Ayurveda practice at Kaiser. And then I semi-retired from my practice in Portland, and now am doing this full-time and having a great time. Board certified in both internal medicine and integrative medicine. So let's look at this slide here. Integrative medicine is now a specialty under the umbrella or auspices of the American Board of Physician Specialties. So there's an American Board of Integrative Medicine, which recognizes, I think, 22 or 23 fellowships across the country, of which we are one. And our fellowship is extremely unique in a number of ways. Number one, it is the only integrated medicine fellowship in the country and probably the world that has a special focus on Ayurveda. So the fellowship program is a collaboration between MIU, Maharishi International University, and the University of Arizona. The University of Arizona contributes the general integrative medicine component of our curriculum to the curriculum. We license material for them. And then the Ayurveda component of the curriculum comes from us, of course. MIU is the largest provider of Ayurvedic training in the West. We have 3 or 4 graduate programs in addition to this one, as well as a number of undergraduate programs in Ayurveda with, I believe, 600 to 700 students, very robust. This program is 2 years online, part-time, and when you're done, you'll get a master's degree in integrated medicine and Ayurveda from MIU. It's another way that we're unique. We're the only fellowship, the recognized fellowship that gives all graduates a master's degree, and MIU is a fully accredited university. It's a real master's degree. And in addition to that, the MDs and DOs in the fellowship will be eligible to sit the certification exam offered by the American Board of Integrative Medicine. The fellowship is designed for busy practitioners like you, and it takes 8 or 10 hours a week of your time. And the studying is asynchronous, except, so on your own time, except there is 1 week each year on campus in Fairfield, Iowa. This year, that'll be the week of October 12th. And in about 3 minutes, Dr. Leslie is going to tell you about that. And number two, every other Thursday night at 7 p.m. Central, there is an online webinar with us, the faculty, and all your colleagues. And live attendance is required. Once in a while you miss, you can watch the recording. In general, we expect live attendance. And so the curriculum, MIU is on a block system. And so we'll go through our curriculum over a period of 2 years, one course at a time. And you can see here the first year's worth of courses. Somebody has a question or something going into the chat, which reminds me that I forgot to tell you that please put your questions in the chat, which someone already figured out. Yeah, the time on Thursday is 7 p.m. Central, 8 p.m. Eastern, 5 p.m. Pacific, 6 p.m. Mountain. So every other Thursday. And in the end, 70% attendance live is required to graduate. So you really need to be there in person. Once in a while, of course, you can miss. And any other questions as we're going, please pop them in the chat or save them till the end because there'll be free open mic question and answer when we're done here. So you can see here on the slide our curriculum and just from the first year. So the first course lasts, I mean, here for 2026, the dates will be a little different. We'll start in the middle of August. First course is 4 or 5 weeks. It's a general principles course. And then we move on to a whole systems course where you'll learn a little bit about naturopathy, homeopathy, Chinese medicine, the like. And then mind-body medicine course, then nutrition and diet, then environmental health and lifestyle medicine, then five sense therapies, then botanical medicine, then business and legal issues. That takes us through the end of the spring, and then we switch gears, musculoskeletal system, cardiovascular system, GI system, and on through the second year like that, through the different organ systems and specialties. And in each of the courses, we will draw material from both the Ayurvedic side and the general integrated medicine side, so it's blended. And it's very fun, interesting, stimulating, and profound. So there's a few things that I always, whenever I'm talking to people about the fellowship, there's a few things I emphasize. One is a big emphasis on self-care. Everybody who enters the program learns TM, Transcendental Meditation. Everyone learns the yoga asanas, the yoga positions, the diet, the daily routine, the exercise prescriptions, the herbals, and we all do these things ourselves. And so the program is intended to be personally transformational. Here's a quote from one of our students giving her capstone presentation at the end of last year. I'm healing by doing my assignments at school. So there you go. We learn by doing and experiencing. Not only the residential clinical week, but the assignments that you have for each week are very often experiential. So emphasis number two is that this program, this fellowship is very practical. So starting from week one, you will learn things that you will be immediately able to integrate into your practice, regardless of your specialty, whether you're primary care, nephrology. We have surgeons in our program, neurologists, dermatologists, whatever your specialty, the material is pertinent and practical. And we, the faculty, have, as I've told you, many decades of experience integrating this material into quote unquote real world allopathic care settings. So it's very practical, not ivory tower. So you'll learn diets, herbals, mind body, five sense therapies, aromatherapy, massage therapy, marma therapy. It's a type of Ayurvedic topical therapies and the like. Music therapy, exercise prescriptions, evidence-based referral guidelines, all very practical for your practice. And number three, we spend a great deal of time and emphasis on pulse diagnosis, which is an Ayurvedic diagnostic and, in fact, therapeutic tool, which Dr. Wegman will talk about in a bit. So I'm going to now transition over to Dr. Leslie Elder, and I'll let her introduce herself and tell us a little bit about herself and the residential clinical week.
Hi, I'm Dr. Leslie Elder, and I'm a family practice physician by training. I've worked at Kaiser Permanente for many years, and then I also had a practice exclusively in Ayurveda. Now I've come on to help teach this amazing program. So I'm going to focus on the clinical week, which for many of our fellows, they say it's the highlight of the fellowship. It's for 1 week a year each year that you're in the program. And it's really a time to learn together with like-minded health professionals. It's a time to meditate together, bond together. And as Dr. Charles said, it's really hands-on practical learning. There's only so much you can learn on an intellectual level, but this is a real different approach. We're all meditating. We're all learning together, and over decades, as faculty members, we've learned how to integrate Ayurveda into our lives in a very practical way, and we want to share with you the practical ways that how you can incorporate this knowledge into your life and benefit your health and the health of your patients. So, we do yoga together during the clinical week. We meditate together with TM and sometimes very large groups, and we do cooking demos together. And there's really a lot of hands-on, fellows engage hands-on with these cooking demos, working together with faculty to create amazing Ayurvedic meals and that we get to sample. And really learning how this can be done, how you can actually create a freshly cooked Ayurvedic meal for you and your family every day. Because we've learned how to do this, and so we know how to teach it. And we like, students to get their hands dirty and really get in there and have fun. It's really like being a part of a family, cooking together. And here we learn, which spices, which grains, which legumes are balancing to your physiology. Each of us has a specific constitutional type. We learn what that is, and then how to, which of these, how to balance your diet in order to balance your specific constitution. And so then also you help your patients with that. So we also, students, it's so amazing, fellows get to learn how to create these really great spice mixtures that you can just easily, incorporate, use for shaking on your food, or making little spice mixtures that you can incorporate in your diet and for balancing your constitution, and all sorts of ways of certain modalities that you can use to do that. And here we have a picture of a very dynamic professor at MIU, Fred Travis. He's a neuroscientist. He's done a lot of research on the effects of meditation, specifically transcendental meditation on the brain waves in the brain. And here we have one of our fellows. One of the fellows, or sometimes two, gets to volunteer to be hooked up to the EEG. They meditate for like 5 minutes, and then we get to see their brainwaves and areas of coherence that occur when you're transcending during your TM program. So that's really a wonderful thing. And he does research on different types of meditation and the difference between the brainwaves between these different types of meditations. So very interesting. We have a number of very dynamic professors here. So also here we see the fellows practicing pulse diagnosis, practicing Ayurvedic pulse diagnosis during the clinical week. We really dive into this very deeply, and it's a very peaceful, kind of deep experience just to feel your own pulse and to learn along with others. And you take the other fellows' pulses, and at some point we also have patients that you were able to take the pulses. Oops. So and then we also see here fellows learning the intricacies of aromatherapy and how to use the different aromas of essential oil blends to balance your constitution and also the constitutions of your patients. So, and at the very end, we always, of each of the clinical weeks, we have a beautiful banquet at a nearby Ayurvedic clinic called the Raj. And it's a beautiful experience of just coming together to celebrate the knowledge and each other. And the fellows all stay in contact. We have bi-weekly webinars. So that's lit or live. And so we really interact with each other throughout the year. And also we stay in touch with each other through WhatsApp groups, et cetera. So it's a nice ongoing community. So let me now introduce you to Dr. Sankari Wegman.
Hello, everyone. My name is Sankari, and I have been practicing Ayurveda as a consultant for over 25 years. I'm a teacher of transcendental meditation, as well as Maharishi Yogasanas, as well as my 200 YT. And my doctorate was in the field of evaluating Ayurvedic curriculum for medical education. And it's been such a joy for me to be part of this fellowship group in really incorporating this ancient wisdom into modern healthcare and seeing how transformative it's been for all of our fellows, as well as their experiences with their patients and what they're sharing with us. And it's lovely to meet all of you. And I'll talk a little bit more about our university and its approach to education, as well as some of the points that Dr. Charles and Dr. Leslie have brought out. One of the points is that our university is very much consciousness-based in terms of its educational approach. So when we say consciousness-based,
Dr. Sankari, the view of your slide isn't quite right. You need to.
Yes, let me do this.
There you go. Perfect. Thank you.
When we say consciousness-based education, what we're really talking about is this field of infinite creativity, infinite expansion that each one of us has within. This is that inner field of intelligence that we have within. And the aim is to really develop that alongside learning. So it's not just in terms of receiving knowledge, but also seeing that knowledge within. And what we also incorporate in our fellowship, as well as in the university, is that everyone learns a transcendental meditation technique. I think one of our fellow participants here already practices that. Everyone learns it as part of their tuition. And the TM technique is one of the most extensively researched meditation techniques, with over 350 peer-reviewed research studies that have shown its benefits in reducing anxiety, helping with depression, PTSD symptoms, cardiovascular disease, blood pressure, et cetera, as well as overall cognitive benefits, learning, creativity, just overall health and well-being, which is really the foundation of personal and professional success. So we incorporate the TM technique as part of the learning module for our fellowship. And this is really what really creates that holistic, meaningful education, because as Dr. Charles and Dr. Leslie both emphasized, it's really about making it practical, as well as providing tools for self-care for every single healthcare practitioner who's going through our program. There's so many benefits to TM, as I mentioned, and one of the quotes that I love is, if a pharmaceutical company had a pill that was capable of doing all these things, if they had all these studies showing how much it could help, how much help it could give, that pill would be $1 billion blockbuster. And this is something, that we just incorporate for every single physician to have that chance to rest, have that chance to access that field of expansion from within, so that they are more effective in everything that they do, whether it's professional or personal. Burnout, as you know, is one of, still one of the most high levels of stress that are affecting healthcare providers. And it's been shown that at least there's one symptom of burnout that affects more than 65% of physicians who are reporting this. And this is why in our fellowship, you can see these are all of the objectives of our fellowship. We have 10 main objectives. And you can see the first 3 right here is really about that connection of self-care. So we want to facilitate whole person health for every single patient. But we also really want to make sure that the practitioner is also practicing that whole person care for themselves in terms of practitioner self-care. This is what allows for that therapeutic relationship to really develop between the patient and the provider, so that everything that you're saying, everything that you're doing is really at that fundamental level between yourself and your patient. So that value of relationship-centered care is something that's experienced so effortlessly, and this is one of our main objectives. And as Dr. Charles and Dr. Leslie said, the clinical week that we have is definitely something that our fellows look forward to, but really it's also something I think we look forward to because we get to meet each one of you and we get to do all of this together. So we do pranayama, different breath work together. We practice yogasanas. We practice meditation twice a day as part of our clinical learning. And then we get into the didactic and the academic content as well. You can see some of our fellows here, after yoga, we learn how to take our pulse. We practice pulse many times during the day. And you can see this is something on the left-hand side, we have exercises that really make this concept of taking the pulse, which is a little bit different than how it's practiced here in modern medicine in terms of beats per minute. This is a very different approach. We have, as you can see here, some of our fellows learning, making it concrete. So some of this can seem abstract, but we really do different exercises during the clinical week to make it concrete. And we learn how to take our own pulse as well as how to take each other's pulse. When we're taking the pulse, this is a deeper way to access that level of balance and imbalance and really understand what the root cause of imbalance is. And this understanding of pulse diagnosis allows us to see that value of balance and imbalance in all the different organ systems, in different areas of the physiology, in the tissues of the physiology. And so in practicing this alongside modern medicine, we're really able to create therapeutics that are very personalized and in the direction of prevention from a very deep level. So we're incorporating this ancient wisdom really right into modern healthcare. And what it provides is such an innovative way to provide more for our patients. And I'm going to turn this back over to Dr. Charles for questions, and we look forward to hearing and answering whatever questions you might have.
Well done, Dr. Sankari. Well done, Dr. Leslie. Thank you. Okay, so we are in, the mic is open. If people have questions, we are available now to talk with you. We're available later to talk with you. I've got my email in the chat. If anybody wants to set up a private Zoom discussion, we're available for that. But here we are. So please, what questions or comments do you have about anything that we've said or anything that's on your mind?
So I have quite a few.
Okay, you're on.
Okay, all right. I've been writing them down. So none of the classes are, the classes are every other Thursday, correct? Not every Thursday.
The webinars are every other Thursday. There's learning going on.
Self-learning.
Yeah, self-learning on a Canvas platform.
Yeah, okay. Yeah, but the classes are every other Thursday. For how long?
90
2
minutes.
hours? 90 minutes. Okay.
They're not always they're not really just classes. They're more like lectures often. Lectures are kind of interacting with each other.
Case presentations.
Case presentations, people working on cases. It's very practical, that kind of thing. So it's yeah.
I see. Okay. There's no classes like, so we're not joining Andrew Weil sessions.
Okay.
They're kind of being put together by MIU.
Right. So the general integrative medicine curriculum at University of Arizona, their fellowship is the didactic part is fundamentally an online interactive textbook. So we and our platform is Canvas. So you'll go onto Canvas and there'll be a lesson. And if it's from us, it'll link you to a video. If it's Ayurveda, a video uh, um, or some reading or something like that. If it's from the University of Arizona, there'll be a link that will take you to their platform for that lesson. And
I see.
then the faculty who are joining so the material, the webinars are clinical. And of course, there's more of an emphasis on Ayurveda, but there's integrative medicine as well. And the faculty is primarily our faculty or guest faculty. Does that answer your question?
Yes. Yeah, guest faculty, not necessarily from Andrew Weil.
That's correct.
Okay.
So I don't think we've had anyone we've had graduates of their program who are board certified. They come all the time. But no, they don't come in, actually do the hands-on teaching is by Maharishi International University faculty. It's an
Okay,
MIU program.
got it. So it's kind of like, okay, I think I understand. So like when you say general integrative medicine, I'm assuming there's like, because I haven't studied integrative medicine, I'm assuming there's like integrative medicine and general is a part of it. And that's
Yeah,
the
so
part where,
Tino, you're really asking very good questions. You are. Yes. So integrative medicine, what's that mean? Well, you take uh, conventional medicine, then you take some non-conventional approach, such as Ayurveda or Chinese medicine or herbal medicine, and you integrate them together in a coordinated way. That's integrative medicine. So now there exists an American Board of Integrative Medicine, and it offers an examination, and the examination has a curriculum. So the general integrative medicine curriculum, it's sort of a Western approach to holistic care, diet, herbs, mind, body. And that part of the curriculum, which is about half of the didactics, prepares you for that ABOIM exam.
okay.
And then the other half, Ayurveda is integrative as well, in the sense that you're using it in combination with Western or with allopathic medicine. But so that core integrative medicine curriculum endorsed by the board that prepares people to sit their exam, that's what
Awesome.
we're calling the general integrative, the core curriculum, we could call it. Yeah.
Okay. So if I understand correctly, it's maybe like half of the Andrew Weil program.
Okay, that was a pretty good guess. I believe
You
yeah,
said half. You said half. So it's not a guess.
yes.
I just want to
So
sure
you were
I'm
listening.
understanding.
You were listening.
Yes.
So correct. About I think that our program is about 1,000 hours didactic, just shy. And I think it's about 430 of it comes from the University of Arizona. Their program is about 1,000 hours didactic, like ours. It's all general integrated medicine. Then they've created this, what we call the foundational fellowship curriculum, which we have licensed from them, and which contains the bare essentials of
Okay.
so to prepare you for the boards. And then the other half is the Ayurveda, and which greatly enriches and provides a new set of skills and new perspective. Yeah.
Um, so out of how many years have y'all been at this or this joint program?
It's not really a joint program. This is a Maharishi International University program. in
Okay.
in collaboration with the University of Arizona. Okay, so
Okay.
and you will be the fourth class if you enter this August. So we will be graduating our second class in June.
Got it. Got it. Okay. I guess you only have then 1 year of people who've sat for the Integrative Medicine Board. I just wanted to get an idea of maybe like pass rate or.
Yes, yes. So what complicates the situation is that the board, currently the American Board of Integrative Medicine offers its exam in May.
I
Yeah,
see.
that's what I said too. So it's not smart. We're trying to get them to move it to October. Until then, it's very difficult to take it right at the end of your fellowship. A few of us did it last year and passed. We had 3 or 4 people do that and pass last year. Everyone else is taking it this coming year. But it was really
Because they were
stressful.
because they were still in fellowship
They
during the
hadn't
time that
finished and they had to cram and had to do some stuff early. And so for this last class, our second class, we didn't even talk to people about that because it was so stressful for everybody trying to get ready
got
for a May exam.
I see.
Hopefully, by the time you sit the exam, it will move to October.
Okay. Okay. I mean, I actually have more questions, but I just want to say that I'm very impressed because this is a very bold thing. I mean, integrative Ayurveda in itself is bold. But like putting it all together, and this collaboration you have, and yeah, it's quite impressive. So I just wanted to say that, but I do have more questions, but I'll let other people ask, but they might have some of the same questions, so I don't know.
Thank you. So we'll see if anyone else wants to ask some questions, and then we'll give you another turn.
Okay.
And we've got Noreen offering some great um, comments in the chat. So please look at the chat. Roshan asked, when is the in-person learning this year? What dates in October? So it starts the week of October 12th, which means you'll arrive in Fairfield, Iowa, Sunday, October 11th. And most people will then leave Saturday morning, whatever that Saturday is after the end of that week. I guess that's the 17th. Unless you live within driving distance of Fairfield, you might leave the Friday night. There it is. Thank you, Dr. Sankari.
I have a few questions, and thank you for those fabulous questions. You kind of knocked out about 4 of my questions, Tina. So thank you for those amazing questions. Now, and I understand that I think you've done Ayurveda for a long time, or have looked into it or know about it. For me, I'm gonna be total naive here. Ayurveda comes from India, and so that was one of the biggest reasons that I wanted to learn about Ayurveda. And then now that so many of my patients have asked me multiple times about recommendations, and I haven't been able to provide any knowing benefits. My question is that as an advanced practice RN, so as a nurse practitioner, I have a PhD, but what is the academic advantage for advanced practice providers? And I know that it is the certification exam or board certification is only for MDs and DOs. My brother is a DO. He's not. He's a fresh new graduate of residency, so he doesn't really want to get involved in it. I've talked to him about it. Well, who knows? I may be able to, try to bring him in. But what happens at the end of the fellowship? What credentials do I get if I were to finish it successfully?
No, you do it. Yeah, so that's a good question. You'll get an MS degree, and so our fellowship is unique in that everybody gets an MS degree. So you will be able to say accurately that in addition to the experience you got, that you have a master's degree in integrated medicine and Ayurveda, which is a credential. And we have had nurse practitioners and physician assistants graduate from our program and go out and they use it in their practice. So the short answer is you will have a master's degree in Ayurveda integrated medicine.
but there is no board examination, or there's no certification examination at the end of the curriculum that we can take.
As far as I'm aware, there is no, within nursing, there is no pathway, so there's no certification like that within the nursing boards that I'm aware of. That's
Okay.
correct.
Okay. Okay, thank you. And then as far as I wanted to know what the division of classes was when we talk about with the University of Arizona, the curriculum, and with MIU. Is there like these are the classes that would take us, and I know it was going to be more of that, there's a link that goes to the website and then we take it there, and then the Canvas platform for MIU. So is there a
Okay,
specific...
so go ahead. So each of the courses, this is the first year curriculum. Each of the I'm sorry, hang on. Hang on. So each of the courses generally pulls in material from both curricula. So they're lined up, right? So you get it. So with the exception of like whole systems is mostly from whole system is mostly from the Arizona curriculum. 5 sense therapies is mostly from the Ayurveda curriculum. Botanical, but it's, generally speaking, we pull in material from both curricula. And so when you go through the way we'll be doing the Andrew Weil, the Arizona curriculum is it follows the schedule that I just put up. It doesn't go linearly through their curriculum the way they teach it. It goes through this, and so we pull in lessons that are relevant to the subject.
Okay.
So the didactic component is about equally divided between Ayurveda and general integrative medicine. Favors a little more Ayurveda, but it's pretty close. And then we have the clinical component, which is the on-site clinical training and the webinars. And again, this is an Ayurvedic program, so it's a lot of Ayurveda and with a solid background in the general integrative medicine.
Okay. And you mentioned that you're naive to the Ayurveda, but you probably, if you have an Indian background, you probably have, right? You probably have some something back in that, in the past that will resonate with you. You'll realize, oh, this is somehow resonates with me. And I think that you're going to learn you're going to really be able to incorporate this into your practice. And because you have a private practice, that's going to give you the freedom to, just to have the freedom to be able to incorporate this knowledge into your practice, which I think your patients are wanting. So it sounds, I would imagine that would be very helpful.
I am very excited about this. In fact, I have one of my uncle and aunt, who are both in India, are practicing Ayurvedic physicians in India. And then I have the rest of my family that is either internists. I have cardiologists, radiologists, pathologists, completely allopathic. So it's a house divided kind of. This is a lot of them in India, a few of them here in the United States. But it is going to be. I'm going to have to talk to all of them to.
You'll bring the family together. You'll be the great unifier.
I'm hoping so. One more question was, so it's a 2-year program. Is there any, and I understand that it is more self-learning, which helps us with, with full-time jobs, but is there a way to fast track this in any way? There's no way to fast track it. Okay.
It's fast enough.
Okay.
And we're not able to, because what happens is we do a course and then that course has to be finished. Then we go on to the next one. And then we do a course and that course is finished. And each course lasts anywhere from 1 to 8 or 9 weeks, depending on the course, most around 3 or 4. And so that means that we have to go on schedule like that. And also means that one course has to be finished before the next is done. So if you fall a little behind this week, you can catch up next week, but you can't put everything off till November or December.
Right.
You got to kind of keep up. Yeah.
It also is, it's under the Board of Education because we also offer a master's. So it's a 2-year master's program as well. And it is very rare, of like the 20 plus fellowships. We are, I think, one of two fellowships that also offer a master's. So it is, it's all under the Department of Education as well.
And one question is that for people like me, for candidates like me that have no specific knowledge, no formal education into integrative or Ayurvedic medicine, is there anything like a precursor course that might be of any benefit to take to kind of help?
All you need, I mean, we can give you books to read in preparation. Everybody in the program learns TM, Transcendental Meditation, and if you enroll, we'll encourage you to do that before you arrive, before the semester starts. And that tuition for the meditation is counted in your fellowship tuition. The university will pay it. No, the requirement is that you be that you are a licensed healthcare practitioner. That's
Yes.
it.
There's lots of people who know nothing about Ayurveda in the course
Yeah.
that start out. They know nothing.
But everybody in this program already knows how to take care of patients.
Yeah.
We don't have to teach you that. And that's
No.
very important because the level of the discussion is geared toward people who are licensed healthcare practitioners.
Okay.
And also,
Thank you
it's
so
so,
much.
just to add to that point, it's a 2-year program,
Mhm.
and everything I mean, we always, there's so much repetition, so it really goes deeply. So it's not just, learning to memorize it, to do it. It's like really learning at a deep level from so many different perspectives, from so many different systems. And it might seem, I mean, Ayurveda just in and of itself is huge. It's vast. As is integrative medicine, as is any of the modalities within integrative medicine. So it is huge and vast, but that's why the curriculum is made in such a way that that we come back again and again from different vantage points. So we really assimilate it deeply within. And it's a real lifelong learning, and even as you're practicing, you're bringing your clinical experience to our webinar, sharing so everyone benefits in that style of learning because you're actually kind of the pioneers right now in terms of how you're practicing this out in the field. So that's really exciting in one way that you just come as you are and you will leave, I think, just so profoundly affected both at a very deep personal level as well as professionally. You're going into a network of alumni from this program, alumni, from integrative medicine fellowships. And also we would love for you to at some point even come back and be part of this for the future. So.
Okay. All right. Thank you. Thank you so much. Yes, I will definitely probably be emailing you, Dr. Elder.
Please. I'd love to talk with you.
Insight. Thank you so much.
Other questions? Anyone?
Dr. Elder, we have Aaron. Why don't we introduce Aaron? Aaron just joined us, Aaron McNeely.
Hi, Aaron. I gave a brief review of the program and we're taking questions. Do you mind just letting us know who you are and where you practice?
Yes, I'm so sorry. I had the time wrong from too many time zone switches. I was actually in Tucson at the Integrative conference there. And that's what inspired me to sign up for the meeting. So hopefully I'll can join another one. But I am in Grand Rapids, Michigan, and I practice in primary care. And I'm also a yoga practitioner. And so looking to learn more ways of integrating these really valuable ancient sciences into my practice.
Wonderful. Welcome, Aaron. And I'll just mention that we have another session tonight starting in 2 hours and 5 minutes if you wanted to join then. And if not, again on April 15th or 16th, whatever that Wednesday is, you can rejoin then if you'd like to. Thank you, Aaron. Other questions or comments?
Dan here. I wanted to thank everybody for the information and for the questions. Pretty much went through most of the questions that I had, and maybe I missed it, but did anyone speak on the cost?
Right. So no one asked that question yet. So the cost of the degree is $36,000 total. $9,000 per semester times 4. Because it is a master's program, federal student loans are available. In addition, we do have some scholarships available, small scholarships, but they are merit and you can apply for those as well. The tuition includes your training in transcendental meditation, and it also includes your room and board when you come to the residential week. So for that portion, you simply need to get yourself to Iowa and back, but the room and board are covered.
Okay. All right. Thank you very much. I appreciate that.
Sure.
I did want to follow up on one thing. Well, I understand the master's. I understand that, but I guess my question is, after this program, could we say that we have a fellowship in integrative medicine?
Yes.
Yes, I can.
You will have been completed a fellowship training in integrative medicine and Ayurveda.
And that's regularly confused because it's a master's in integrative Ayurveda and integrative medicine. It's a master fellowship. What?
Oh, no, okay, fair enough. So you'll get an MS in integrative medicine and Ayurveda is what we call it. And then you will be
Okay.
eligible to be certified by the American Board of Integrative Medicine.
So I can't really say I have a fellowship in integrative medicine. I mean, this.
Well, you can. I think, if you go on, you can. We describe ourselves as fellowship in integrative medicine and Ayurveda. So
Why can't you say you did a fellowship in integrative Ayurveda?
yeah, I don't think
Fellowship
anybody would box your ears for that.
Okay, all right, that's fair. But it would be through MIU, which is in collaboration with Angela.
Right. So your degree will be from MIU.
Okay.
Okay. And our fellowship is, they're close collaborators. We like them. They help us a lot.
They like us.
And they like us. They respect what we're doing. But because precisely for the reason you said, because it's very bold and they recognize that. They are separate programs. Ours is run by MIU. And if you go to the ABOIM website, you'll see all the programs listed. They have their own program and we have ours.
Okay. Classes start August
15, 16, somewhere in there.
August 17th, 18th.
There you go. Thank you. 17th.
I think so.
Okay. And classes start then. Oh, when do you need applications in by?
So the application, the sooner the better. The application deadline is in the first part of July.
I will check that and put it in the chat.
The exact
Thank you.
date. And the sooner you apply, the better. There are a limited number of scholarships, which are first come, first serve. So we would encourage you to apply soon. Applying takes about 20 minutes to half an hour.
Okay.
Online, and it costs $20 to apply. Very easy.
And the scholarships are like first come, first serve. They're not like
First
based
come,
on
first come, first serve. They are merit based, and they're $1,000 scholarships.
Okay, per semester or flat?
Flat.
Okay.
And
and how many people in the class?
Dr. Sankari, did you?
I was just saying the deadline, just wanted to thank Noreen for putting the deadline to apply is July 15th of this year.
Okay.
So just wanted to mention that.
But don't wait that long.
Aaron,
Yeah, I just put it in the chat, the deadline. But you want to try to apply earlier. It makes things easier.
Yeah, and we have about between 8 to 20 per class, just depending on how many have come in. Yeah.
And you showed us the first year curriculum. Is there a second year curriculum online we can look at?
There is the second year. Well, you can find it.
I can share the academic calendar from a previous time, Dr. Charles, if you'd like.
Please.
Okay.
So while Dr. Wegman is looking for that, yeah. So essentially we run through the
I
organ
will
system.
also put in the chat a link to MIU's just general academic calendar that applies to all programs. So, you can access that if you're wondering about dates or holidays, things like
Yeah, so I will.
I'll include that.
Okay. This one is just sorry about the size of it, but you can see this is from 2020. It's a little bit, I guess it's 2026 to 2028. Oh, so this is your calendar coming up. So you'll see here, sorry, I'm just trying to get the size of it. You can see on the left, it's split into year 1 and year 2. And then you can see the fall semesters, spring semesters right next to it, as well as our summer breaks or any breaks that are included. And then you'll see the first year is more of an introduction to the fellowship, as Dr. Charles mentioned. We start the different systems towards the end of the spring of the first year, and then we continue through all the different systems into the second year, as well as going into obstetrics, pediatrics, aging, longevity, and palliative care. And at the end, we also always have our webinar dates, so it's every other Thursday, as mentioned. And this is something that you'll receive when you join, but you can see all the courses that are listed there, as well as the breaks that are there. One other thing that's part of our program is a capstone. And this is something that if you have a specific area of interest you'd like to go into more, you can do more research into that. If you'd like to, we have fellows who have done research as well as part of their capstone, or they've done personal journeys that they've then presented at the very end. So the capstone presentations will also come towards the end. So we really want to make it very much in tune with whatever you would like to do and explore a little bit more of. There's room within the program for that development, along with mentorship to help support that.
Another question. Are the teachings that we're doing, I'm just going to put it out there, are they reimbursable by current insurance programs, or these are usually out of pocket if you practice them?
Okay, that's a good question. So the whole issue of billing, and if one is a licensed healthcare practitioner,
nutritional counseling.
That's one way to do it. And if you're a licensed healthcare practitioner, the way I did it is I time coded. Is the short answer. Leslie had a private practice, and go ahead.
Well, in Ayurveda,
but so she billed it as nutritional counseling.
Yeah.
Right, but she's family practice. So the best thing to do at this point is one can time code, and then it also depends on what you're doing. But the short answer is time code it.
I'd like to make another comment on this. I was administrative director of a Ayurveda clinic where the medical doctor for 14 years was doing Ayurveda and was billing insurance. But what the doctor always did is for each code that you have to do a certain number of diagnostic and other things. You have to fulfill. If you fulfill everything for that code by doing the regular modern medical workup and doing the regular things you do, and you spend an extra 10 or 15 minutes on lifestyle and digestion and maybe nutritional supplements, you can still bill that code. You've met all the criteria and you've actually done something more. You've spent a little bit more time. So that's how we did it in our practice. We met all the criteria for each code. And then the doctor spent a little bit more time on lifestyle and diet. And that did not seem to be a problem. It was very easy.
And in my practice, where I was in a very structured environment where I couldn't, at Kaiser Permanente, can't spend a little bit more time. To me, this is just primary care. It's just a different way of doing primary care. I'm just telling my patients about diet and daily routine and herbs, stress reduction, mind, body. Oftentimes, the herbals are better. I'd rather have my patient taking Boswellia than Motrin. It's just a better choice. So that's you can call that Ayurveda. You just call that good primary care.
Thank you so much. I have something at 5, but this is excellent. I commend you guys. And I will be in touch.
Great. Thanks for
Great
joining,
question.
Dr.
Great
Tina.
question.
Questions.
Thank you so much. Thank you, Dr. Elder. And thank you, everybody. I think this was a very informative session. It kind of opened my eyes towards a lot of things that I can say. And I'm excited to collaborate. I'll definitely be in touch as well via email, and we can discuss a little bit more about the time frame. Thank you.
Wonderful. Thank you so much.
Thank you.
Okay, well, thank you all for joining. And again, we're eager to talk with you more. It's been great getting to know you a little bit and talking about this really exciting thing that we're all doing.